by keeping as many people healthy as possible that may not be able to get health care anywhere else, and by keeping our patients out of emergency rooms when that's really not the care they need. Well, our mission here is to serve those that don't have reasonable insurance. We primarily work with the working poor. We have very few staff, most part-time. We are the support behind the volunteers that pretty much run our programs. During COVID time, we've stepped in with a lot more responsibilities, as you can imagine, because we just don't have the capacity, the numbers of volunteers coming in to assist us. This is our dental clinic. We have dentists coming back now, so we can start seeing patients again. And this is one area that really does fall through the cracks in healthcare needs, and they really don't have many places to go besides coming here. We support CVTC and Marshfield Clinic's dental clinic. There's a long wait list, and of course, we only see our patients here, so that helps.
We have the vision clinic, which comes once a month, and then we have the medical clinic. We also have mental health services, and then we have the diabetic education. We have the diabetic foot care. One patient that we've had that is a diabetic had foot ulcers, but we noticed that his pulses were decreased, and so he had what's called an ABI, which showed that he had blockage in his circulation. And the radiologist mentioned that if we would not have caught that, he would have had to have more than likely an above the knee amputation.
And then our medication program is another one. We offer free medications to all of our patients, and many who are treated in the hospital settings will come back with prescriptions to get filled here. So again, limiting their out-of-pocket expenses. We're a satellite of the health department where we provide free immunizations to those that might not get them anywhere else and make sure everyone's up to date. And seasonal vaccines as well, like flu and pneumonia.
United Way helps fund Healthier You. And along with our medical practices, we want prevention and well-being as well. So we have a program in place that deals with physical activity and nutrition. And then we also have a program called Sharing Dignity, which is outside, again, the medical practice. And that is a feminine hygiene program for women. You know, we found that that is a high-cost area, high-ticket area for women. New underwear purchases and feminine hygiene and bath products are really something that a lot of the low-income working poor just don't have the money to purchase, so we give that at no cost to them too. And then we have an over-the-counter area, help reduce the cost for our patients again, and all of this is offered at no cost to them, so we can help lower their out-of-pocket expenses.
One way of looking at it, almost 1.5 months is completely funded by United Way donations of our patient care, the services, the free medications, the free eyeglasses, all the services we offer. If you throw that into a 12-month plan, you take care of 1.5 months of it for us. If not for us, I believe people would be presenting again to the emergency or urgent care departments much sicker, because you can imagine if you don't have the money to pay for your health care, you're going to put it off as long as possible, or you're going to extend your medication as long as possible. With these free services, they can take their insulin when they need to. They can take their medication for cardiac issues every day if they need to, and not split pills and that. So, I mean, the stories behind what we do are life-saving in a way. I think the most important thing to recognize is that we are a community-based clinic. We aren't a national program that trickles down into various communities. Free clinics are created because the community has a need and wants to take the burden off of other healthcare systems. So the United Way support is so critically important to us because it's, again, community-based. And however we're funded and how much we're funded determines how much care and free services that can be provided to the community. So we're very appreciative of United Way and all that is done because it helps the community stay healthy.